Hi guys. All right. So the day has finally arrived, and I have been waiting to get my COVID-19 vaccine, and I get to do that today. So I'm headed now to Northwest Clinic, and I'll catch you all later. Bye. Okay, go ahead. There it is, guys. This is Linda.
Happy to give the vaccine today.
Thanks. Thank you so much. Hi guys. So I'm back home now, and I wanted to talk to you more about today. So this is kind of like a video journal. I received my COVID-19 vaccination today, and I had it at the Mayo Clinic Northwest campus. It was quick and easy. It was super organized. There were ushers everywhere that guides the patient step by step through the process. So what usually I had a wonderful nurse, and she explained everything to me, what I needed to know. For example, like what symptoms do I need to expect if they should occur, or but also the allergic reaction, the severe allergic reactions, if it does occur as well, which would prompt you to call 911 if that ever happens. So the symptoms that she told me to expect are the common reactions to the vaccine are usually pain and redness, or swelling where the shot was given, fever, fatigue, headache, muscle pain or joint pain, and chills. So those are the common reactions. The severe allergic reactions is what you call anaphylaxis state, or anaphylaxis shock. That's when you start to feel your throat closing in, you have a hard time breathing. All of a sudden you have a hard time breathing. There's like rashes or swelling all over. So that's an allergic reaction, and you should call 911 immediately. Do not wait for anything. Do not wait for your second dose to report your allergic reactions right after your first dose, okay? And they also expect, if this would occur, it's usually within 4 hours after your first dose. So with me, since I don't have any, I have no known allergies with food or medications. I didn't have to wait for 15 minutes after the injection was given, or the vaccination was given. Normally, that happens only if you have some known allergies. But since I didn't have any, I don't have any. I didn't have to stay 15 minutes to be monitored. So how is this? So let me tell you how the process starts. Since December of last year, the COVID vaccine was approved and was started to be distributed to certain hospitals, and also get people vaccinated. Our frontline workers were the first ones to get vaccinated, and every month thereafter, certain groups of people would qualify for eligibility for the vaccination. From March to April, the ones that qualify are, I took some notes, so just give me a minute to open it, so that if you are in this category, if you haven't received notification yet from your doctor, I advise that you call them up and just tell them that you qualify for the March to April group of people to be given vaccination. So these are People with specific underlying medical conditions such as sickle cell disease, Down syndrome, active cancer treatment, immunocompromised from organ transplant, oxygen-dependent chronic lung and heart conditions, targeted essential workers, food processors, plant workers. Another group are people with rare conditions or disabilities that put them at higher risk. Another group is people 45 to 64 with one or more underlying medical conditions. Another group is people 16 to 44 with two or more underlying medical conditions. Third group is people age 50 and over in multi-generational housing. So generational housing means that in one household, if you have your grandparents living there and your parents and the grandchildren, that's what it means. Multi-generational housing means. Another group of people are the essential frontline workers, which are in the category of like agricultural, airport staff, additional childcare workers, not previously eligible. Wait 1 second. Those that work in the correctional settings, first responders, food production workers, food retail, food service, judicial system workers, and the underlying medical conditions that increase the risk of severe illness from COVID-19. So if you have this and you are at the age between 14 to 64, if you have active cancer, chronic kidney disease, COPD, which is chronic obstructive pulmonary disease, diabetes type 1 or 2, Down syndrome, heart conditions such as heart failure, coronary artery disease, or cardiomyopathies, immunocompromised state, or what we call weakened immune systems from solid organ transplant, HIV, bone marrow disease, chronic steroids for more than 30 days, immunodeficiency disease, or taking immunosuppressive medications. Also, if you're obese, pregnant, or have sickle cell disease. So these are the underlying medical conditions that if you have this and you're between 14 to 64 and you haven't received any notification yet from your doctor, I suggest giving them a call. There's been a lot of literature already about COVID, so I'm not going to focus more about that, but just some things that you need to know. You should not take ibuprofen, or according to the nurse, these are the questions that was one of the questions that I asked her. You should not take any ibuprofen or Tylenol 6 hours after you get vaccinated. So wait, if you are experiencing pain, if you are experiencing headaches or a fever, they are recommending for you to take it after 6 hours. Okay, wait 6 hours, then you can take it. Also, you shouldn't have any with the Moderna vaccine. You should not get any other vaccines in the next 6 weeks. So wait, if you're in line for another set of vaccinations, wait until 6 weeks. I'm talking about not the second dose. Okay, like for example, I'm already scheduled for my second dose, which is after 28 days. If I'm correct, is it 21 or 28? After 28 days, I'm already scheduled for that. That's going to be on April 22nd. So I'll be going back for my second dose. What I'm talking about here is the one, for example, you haven't had your flu vaccination yet, or shingles, which or I don't know, whatever booster that you still need yet at this time. You cannot take it within, or just wait after 6 weeks, and then you can schedule that. Scheduled to get that. Another thing that I wanted to talk to you, or another thing that I would wanna let you know. I think I've covered the emergency. the drug interaction. Oh, it's also safe if you're taking medications, prescription medication. Still take it. That's what the nurse said. You don't have to wait to take that. You can normally take that, except for, like I told you earlier, just the Tylenol and the anti-inflammatory, or ibuprofen, the NSAIDs. They advised for you not to take that within 6 hours. Within 6 hours after being vaccinated. So wait after 6 hours. Lastly, they have given me also literature on what is called the vsafe. This is a way for it's an after vaccination health checker. So I guess what happens, I'll just read this to you. So it says, what is vsafe? vsafe is a smartphone based tool that uses text messaging and web surveys to provide personalized health check-ins after you receive the COVID-19 vaccinations. Through vsafe, you can quickly tell CDC if you have any side effects after getting the COVID-19 vaccine. Depending on your answers, someone from the CDC may call to check on you, and vsafe will remind you to get your second COVID-19 vaccine dose if you need one. Your participation really does make a difference, and I do believe in this as well. The vaccination is new, and this is a way for the CDC to gather more data about the side effects that people experience after getting the vaccine, and then it's also going to this will help also in creating more vaccines that will help protect us. So this is basic why I know there are some people that are hesitant in getting the vaccine. I totally understand. Fear of the unknown is always what drives some people, or most, but it's why immunizations are given is because it's for your protection and for the protection of others as well. So look at this in this perspective. A million years ago, smallpox and the polio virus was so predominant that had killed a lot of people or disabled a lot of people. Now it has been eradicated. There are absolutely no more cases of smallpox and polio. This is similar. Okay? This is similar. So you are, when you get the COVID-19 vaccination, you get immunized, and it's one of the immunizations that are given, similar to the flu virus. If you take your flu viruses yearly, this is similar to that. So that is just the main point, and it's for protection. If there's enough people that have the immunity, or if enough people get vaccinated, it means that a lot. It's called. I think the term is herd immunity. It's a lot more people that will be protected, and others will be protected. And a lot more people will be protected as well from this. And so far so good. I'm not feeling any pain on my injection site. It's been about maybe 45 minutes now since my injection. No symptoms whatsoever. I feel fine, and so I will just on a day-to-day basis, for the next 3 days, just let you know, because let you know if any other symptoms have occurred, and then also when I get my second dose, expect the same. They will let you know to expect the same symptoms if it does occur. Okay, so have a good rest of your day. Please, I'm encouraging everybody to get vaccinated. Of course, it's totally your discretion, but I do encourage you, just for your own protection and for the protection of others as well. You guys take care. Also, one more thing, I just wanted to emphasize this before I let you go. Dr. Fauci and also the CDC recommends that to continue practicing your safety measures, like wearing your face masks and practicing social distancing, what was that? And washing your hands. Still continue to do that even though you have been vaccinated already with the COVID-19 vaccine. And unless they tell us differently, then let's continue to do that and stay healthy and safe, everybody. Take care.